All of the attention on GLP1 drugs these days is gearing up for them to be the next opioid crisis manufactured by Big Pharma. You're falling for great marketing by a profit-driven industry. As an employer, you're being told you can save future healthcare costs by helping overweight employees lose weight, but the data just doesn't back this up. We'll look more closely at diabetes in a separate video, but spoiler alert, GLP1 drugs don't make sense for diabetes either. But so many employers are distracted by the promise of helping overweight employees right now, it's really made the craze get out of hand. Now, back in the 1990s, there was another weight loss craze called fen-phen. Don't know if you've heard of that, but there was a weight loss drug called phentermine with a PH that came out in the 1960s, and then another one called fenfluramine with an F came out a few years later. Both were marginally effective and never really caught on. But then, as the medical industry managed to get obesity categorized as a disease, there was a push to combine the two into fen-phen, and that really took off. There was a frenzy to get hold of this drug as a quick fix to lose weight. The only problem was it was later taken off the market as it was found to cause heart valve damage and pulmonary hypertension. There was billions of dollars in legal settlement. Nobody had thought to do any trials to see if the combination actually was safe. But the saga of fen-phen is eerily similar to what we're seeing now with Ozempic and its GLP-1 cousins. Aggressive marketing, Hollywood and sports personalities getting on the bandwagon, off-label use. I've linked in the note to an article where I provide a bit of explanation on how GLP-1 drugs work and what in the world is a glucagon-like peptide 1 receptor agonist anyway. That's the full name of this category of drug. But I just want to highlight a few of the known or the best known adverse effects of these products on the body that maybe people aren't talking too much about. So number one is obviously gastrointestinal damage. The drugs affect your appetite, but the same mechanism also affects the rest of your nervous system, which slows down the passage of food through your stomach and can ultimately lead to stomach paralysis, which is a really serious condition. But even before you get to that point, you're damaging the machinery that extracts nutrients from food and that basically runs your whole body. Another well-known concern is the loss of muscle mass and bone density, which can sound fairly benign, but muscle does far more than hold up your skeleton. It's metabolically active, and so you're damaging the very system that you're trying to improve. GLP-1 receptors are not only in your intestines, but in your brain as well, including those areas responsible for emotions and reward systems. They influence dopamine levels. So while curbing your appetite, they're also dulling your desires for other activities like social engagements and movement or exercise and something like that. And they've even been known to dampen your sex life. There's been reports of irreversible kidney damage being linked to GLP-1s and related issues like high blood pressure and electrolyte imbalances. These are just some of the better known consequences that we've got really good data on. I cover some more in the article. But look, the validity of focusing on overweight employees, definitely something there, but we have to help them get to the root cause. It's always very individual. It can include any number of elements such as poor gut health and damage to the microbiome, unbalanced hormones, thyroid dysfunction, liver impairment, maybe there's some toxin, maybe even in the workplace, sedentary lifestyle, of course, a lack of protein and good fats in meals, too much processed food, including seed oils, high fructose corn syrup, chemicals in the food, additives, food colorings, pesticides. Nutrient deficiencies is huge. Your body's not getting what it needs to function properly. Poor quality sleep. We have to help employees understand that addressing these underlying causes will help them get healthy. And then dropping the weight is just going to be a beneficial side effect. And there's a slew of wonderful health solutions out there to help employees with this journey, however far they have to go. And we need a whole separate video to talk about them all and compare and contrast. But in brief, you've got, firstly, just the food-focused solutions like Food Smart, Season, Every Table, Good Measures. Then you've got the specific weight management crowd like Noom, Monge, Real Appeal, and then there's the more clinically focused group for diabetes and pre-diabetes led by Signos, there's Livongo, Vida, Verta, Digby. Look, let's not wait for the lawyers to get involved. Let's help employees make good decisions and there's going to be savings on your pharma budget, and that's just going to be a happy side effect.